everybody, this is Jeffrey with Project Platform in Reno, and today we're talking to Dr. William Clearfield. We've had quite a few sessions with him, and hopefully continue giving us tips. And I asked him today if we could just talk about something that he doesn't really know what I'm going to talk about when I ask some questions. And what I want to do, his question is non-surgical facelifts, because I have a friend of mine who's an incredible plastic surgeon, and he's told me in the past that not everybody needs plastic surgery and can't afford it. Yeah, they can't afford it.
And anesthesia.
And there's non-surgical.
We have a lot of simple techniques that look good.
Okay.
They're not permanent. They're not like the surgical facelifts. They don't last as long. They don't cost nearly as much. And there's minimal to no anesthesia, just local anesthesia, if that.
So to give props to plastic surgeons, and it's you're not a plastic surgeon.
Not a plastic surgeon.
But you perform these, and I'll ask you what kinds they are in a second. But so plastic surgery is right for some people and not right for other people. But I knew someone who had a non-surgical plastic surgery, and she expected it to be exactly the same as if she had a facelift.
And it won't.
And it won't.
It won't.
See, that's okay. So that's what I wanted.
You have to be realistic about it.
Right.
Okay.
And there is a difference. But if you just have a little bit of something like, maybe I could have a little bit done, and it would be fine.
Yeah, and what our goal is for you to look refreshed, almost look like you were on vacation. That's
okay.
Rested and on vacation.
Okay. So So what type of non-surgical?
Well, like I said, we have a lot of techniques. We use neuromodulators. The most famous one is Botox.
Oh.
And that's for the lines that go across.
Okay.
Okay.
I didn't think of that as plastic, non-surgical plastic surgery. Okay, that makes sense.
Okay. And I have true confession. About 4 or 5 years ago, I actually had a little bit of a meltdown, and I was going to give it up. And so I went back to Botox 101 school, and the instructor where I went said to me, I don't do it exactly the way they teach it in most places. I do it the acupuncturist way. At which point I went, I should have had a VA.
Yeah, there you go. There you go.
So I taught acupuncture needle techniques since 1992.
Okay.
Right? So why I didn't put 2 to 2 together, I don't know. Oh. So what we do is, instead of going straight in here, so we're taught to go straight into the forehead, just like
that's
this.
where you're taught it.
That's the way it's taught. We go in at angles. We get the
which makes more sense.
Yes, we get it hurts. It's much less painful. It's much less cutting. We rarely, if ever, get any bleeding or bruising.
Yeah.
Since we've been doing this, I've had essentially no complications.
Okay. Great. Wow.
Mm-hmm.
So do you get bruising from that?
You can. I
Okay.
mean, first, if you're on blood thinners, obviously you get bruising. If you're a bruiser, you will.
Okay.
If we would put some Botox here, where you have this nice big, show them your nice vein here. I'd obviously want to avoid that.
Oh, okay.
Right? You obviously want to avoid that.
Okay.
So we would put Botox. We would put it here at the edge of the eyebrow, right here, on both sides here, and that would take care of this here.
So do guys get it?
A lot of guys.
My guys get it. Now, what's this?
They always tell me, don't tell anybody I was
right,
here.
exactly.
A lot of them want to come after hours
yeah,
too.
Exactly. I got you.
Right.
I got you. So what else?
And then we can do fillers. So there's any number of fillers. There's a lot of them now. There's probably about 15 different types out there. And fillers are mostly, the most popular ones are made with hyaluronic acid, which is the same type of material that we find in our joints. And so it's an all natural product, and it's very low incidence of allergies or allergic reactions.
Okay.
In fact, I don't think I've been doing them for about 15 years. I don't think I've ever had one.
Okay.
So with the fillers, and they keep getting better and better and better, and they keep coming out. There's newer and newer products also.
Okay.
So the original fillers, we would just put them in our
Oh, that's what the fillers would do. I see. Yeah.
Okay.
You got big creases.
But now we've done a lot of work, and we've studied the anatomy much better. And instead of just filling it in here, what we'll do is we'll put it in here, and and you see what it does to the line there? It brings it right up. Okay, it looks very nice.
Don't look younger. Can you just walk around like this with me all day, or should I just go hello? So, all right. So we have Botox, we have fillers. Any couple quick ones that we can talk? Other ones?
Well, you want to talk about the thread lifts, or should
So,
we do that on the?
You know, so okay, well, tell me what you have. Threadlift.
We have threads. So threads are
Threads.
Yeah.
Okay.
So they are. It's surgical suture.
And it's
the same-
different than it used to be.
Yes, it used to be. They used to
Okay.
be permanent. They
So
used to be-
why don't we should talk about that. We'll do another time. We have a little bit more time. We'll talk about Threadlift. So what's another one though? You have Vampire.
Oh yes, the vampire.
The Vampire Facelift.
The
right?
vampires.
So we
yes.
got to do a session on that too, because I've seen a couple people with the Vampire Facelift, and they look pretty good. And I was shocked. I was shocked what it is. And you also have, well, that's about it, right, for facelifts.
Is that enough?
That's enough. So
Coming soon, though. We do have coming soon.
Okay.
We will be doing the Y lift.
So look for the Threadlift and the Vampire Lift videos that we'll do and we'll talk about. And so if you're considering plastic surgery, in my opinion, this is my opinion, I'm not a doctor, but my opinion is talk to Dr. Bill first to see if these are solutions that might be better for you and less expensive, and then you'll know if you really should have plastic surgery or you should go to plastic surgery, unless it's something drastic that you want to have taken care of. But it's less invasive. So there's not much heal time for
Most of
Botox
these,
or anything.
most of these
Fillers.
are a day and a half,
There
2
you
days
go.
tops.
All right, and if you even have bruising, it'll be a couple days, right?
Yeah.
Okay, cool. So I'm glad.
We'll give you some more.
I just kind of threw him on this one, and
I had no
I
idea
had
what we were
I said
doing.
some questions because I have friends that have talked and have had it done, and my friend's a plastic surgeon, and he was telling me a lot of good things too. So, all right, that was awesome. Thank you, Dr.
Thank
Bill.
you.
All right, and Joel, our camera guy, thank you very much.
U.S.
And
Marines, ooh-ah.
so everyone, please have a wonderful, wonderful day and be a good human.